Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to talk about the signs of pregnancy that you need to know for your maternity exams. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. For exams, you want to be familiar with the 3 different categories for the signs of pregnancy. And those categories include presumptive, probable, and positive. And what's going to happen on an exam is that you're going to get a scenario that will either have these signs and symptoms, and you'll have to identify if it's presumptive or probable, or they'll just tell you select the presumptive signs of pregnancy, and you'll have to be able to know what those are. So to help you keep these signs and symptoms separated, I've created these mnemonics which will help us be able to identify each category. So first, presumptive. The word presumptive means speculation or unconfirmed. So these signs are really going to be signs that the woman only experiences herself. It's something that she's going to report to you. So they're very subjective. And they don't necessarily mean that a baby is growing in the uterus. They can actually be attributed to other things. And just looking at these signs and symptoms, they can be associated with the signs and symptoms that a woman actually gets before her period, known as PMS symptoms. So to help us remember these signs and symptoms, we're going to remember the word presume. So P is for period absent. The proper term for that is amenorrhea. R for really tired. She's just very fatigued. E for enlarged breast. S for sore breast. U for urination increase, like the frequency. M for movement perceived. And we're talking about movement in the lower abdomen. She may report feeling, I feel like the baby is moving. I can feel this fluttering sensation in my abdomen. For first-time mothers, this tends to happen around 20 weeks. For women who've already had children, about the 16-week gestation mark. And this is referred to as quickening. And then E for emesis and nausea, so we're talking about nausea and vomiting. Then we have the probable category. Now the word probable means it's likely. She probably is pregnant because based on these signs that we're seeing, we have some reasons to think that she likely is pregnant. So with this, the nurse, the doctor, whoever's examining the woman will be able to observe and document these signs. Now one thing that's really going to help you with this category is that in this category, it has all those fancy sign terms that you have to know in maternity nursing, such as Goodell's sign, Chadwick's sign, and Hagar sign. So if you see one of those signs, it's pointing to the probable category for the signs of pregnancy. And to help us remember these signs, we are going to remember the word probable. So P is for positive pregnancy test. R is for returning of the fetus when the uterus is pushed with the fingers. This is known as ballottement. Remember that term. Specifically, what I'm describing here is external ballottement, and this is where when the fingers are taken and the uterus is pushed, the examiner can actually feel the fetus move and then like bounce back up against their fingers. O is for outline of the fetus when palpated. So when the examiner is feeling on the abdomen, they're feeling something there. It could be a baby, but it could be something else. B is for Braxton Hicks contractions. These are irregular, not very painful contractions that don't result in that cervix being dilated. They're just really practice contractions. A is for softening of the cervix. This is known as Goodell's sign. So remember that. It happens around about 6 to 8 weeks gestation. B is for bluish color of the vulva, vagina, and the cervix. This is known as Chadwick's sign. Can happen around 4 weeks gestation. Then we have L for lower uterine segment softens. This is known as Hagar's sign. It can happen anywhere between 6 to 12 weeks. And then the last part is for E, the enlarged uterus. And then the last category is the positive category. The word positive means conclusive, absolute, definite. So we definitely have a fetus growing in the uterus. Now an easy thing to remember about these signs is that the fetus itself is really providing you with that evidence that they are there in the uterus. So we can attribute these signs to the fetus. So to help us remember these signs of pregnancy, we are going to remember the word fetus. F is for fetal movement felt by the doctor or nurse. E is for electronic device detects those fetal heart tones. T is for the delivery of the baby. U is for ultrasound detects the baby. You can actually see it with the ultrasound. And then S is for see visible movement. So the doctor or the nurse can actually visibly see the baby moving or kicking. Okay, so that wraps up this review over the signs of pregnancy. And don't forget to access the free quiz that will test you on this content.